I had a very good look from the front to make sure that the crowns did not stick out. This is quite important, especially for patients that haven't had any teeth in the back of their mouth for quite some time. The buccal mucosa tends to fall into this area. It is important that these tissues do not encroach upon that area and that they remain within what we call the envelope, being the ideal occlusal arch. We check that very carefully. And one of the things that I also do in cases like this, because the tongue tends to always bulb out into this area, and this is specifically what I'm talking about, because the tongue has learnt to move into this area, to seal this area up as the patient chews, this tongue is going to reject teeth in this area initially. The patient is going to bite this tongue a number of times, and you have to coach your patient carefully with this. It is also very important, therefore, that when you place crowns in the top and in the bottom here, that these crowns are placed in such a way that they remain within the occlusal arch and not go too lingual or too buccal. And with that in mind, I always inspect these crowns from all the angles. So here's the side view of what the crowns look like. And I also want to make sure that it's easy for the patient to be able to clean these areas with an interdental brush. This is the working model on the other side. And because we knew that the patient had a less than ideal occlusion, and because we knew that the patient bruxed, from the outset it was a non-negotiable that he had to wear a bite splint, and he knew that. It was on his treatment plan and he had agreed to wear that. And I'll show you that in a minute. And finally, I also like to inspect the crowns from the posterior. In other words, the view that you can normally not see unless it's outside the mouth. So this is looking from the inside. And we can see the 4-6 and the 1-6 site. It is a good idea to remove the silicone that the lab place in these areas to replicate the gingiva, to make sure that the contact points and the emergence profiles are ideal.